Okay.
This is my reflex hammer. Feels like this. I'm gonna hit it in different areas, testing different reflexes. Okay. All right. So we're gonna do the jaw jerk reflex first. If you could open your mouth slightly. I'm gonna grab this jaw. There you go. Actually, thank you. Keep your eyes closed when we do this. One more time. Good. Good. Normal motion should be an upward jerk, upward movement without deviation to either side. That would be testing the trigeminal nerve. I'm gonna do the biceps. Put both hands like this for me. Both hands up. There you go. Go ahead and make a fist with this hand and flex your bicep. Good, and relax. Good. Now close your eyes. Pull it down. Good. Same thing on the other side. Same thing. Make a fist for me. Flex it. Good, and relax. Good. Good. Relax. Be testing the musculocutaneous nerve, brachioradialis, pinkies onto your forelegs, thank you, thighs, there, good, I think I'm supposed to hit there actually, so I'm going to redo that, we'll do it over here, close those eyes, good. That's testing the radial nerve. Tricep. You can pull your arm out to the side, let it hang. Should be under. No, it's back here. Good support. That's also testing the radial nerve. And then patella, go ahead and scoot your butt back on that seat for me. Let your legs, yeah, perfect, that's good. Alright, now you do that same thing, go ahead and grab your hands, we're gonna do that distraction, grab your hands and pull. Good. And same, pull. Good. Alright, we're testing the femoral nerve with the patellar, and now the Achilles. We're going to be testing the tibial nerve. Good. Good. All right. Cool. Now we're going to be on to visceral reflexes. So we're going to do some little light things. You can sit normal for me. Direct light response. Hold this one. Alright. Direct light response. The expected response is the ipsilateral pupil to constrict upon contact with the light. The afferent sensory nerve is cranial nerve 2. The efferent motor nerve is ipsilateral cranial nerve 3. And the integration center is the midbrain. Indirect light response. And then do the other eye. Same thing. Now, the indirect light response, the expected response is contralateral pupil constriction. The sensory nerve is cranial nerve 2. The motor nerve is contralateral cranial nerve 3. And the integration center is in the midbrain. I'm watching the other eye. Good. Watching the close eye. Good. And the other ones. This is accommodation. All right, so we're gonna have you watch this. Good. And where is that? That is the convergence of the eyes with pupillary constriction. That's testing optic nerve sensory 2. For afferent, the integration center is midbrain, and efferent is ocular motor nerve 3. Yep. All right, we're gonna do the carotid sinus. Now, reduction in the heart rate when the examiner presses the carotid sinus. So what we're going to do is go ahead and set this to the side. Sorry, thank you. Set this to the side. Grab our radial pulse. Good, got it. Now we could feel, based on carotid pressure, a decrease in heart rate. Good. A decrease in heart rate. All right, and now the ocular cardiac. So I'm going to have you close your eyes and do the same thing. I'm gonna apply pressure to your eye. Feel the same thing, reduction in the heart rate. Good. And then the ciliospinal, which is gonna be pupillary dilation when the examiner pinches the base of the neck at the cervical sympathetic chain. So I'm gonna grab the base of the neck, go ahead and open your eyes, and I'm gonna squeeze and look for that pupillary dilation. Cool. Now to the superficial reflexes. So we're going to go with, well, we don't do the, alright. So if we were going to do the gag reflex, we would take our tongue depressor and scratch back of the throat, inducing the gag, which would be the afferent glossopharyngeal nerve and the efferent vagus nerve integration center in the medulla. Cool. Sorry. I'm gonna have you stand up, take your shirt off, and face the back of the room. This is a pinwheel, a neurological pinwheel. It is sharp and prickly. It should feel sharp and prickly. Does it feel sharp and prickly? Mm-hmm. Good. Thank you. All right. I'm gonna just run this down the insert portions of your back. Drawing inward of the scapula when the skin or interscapular space is interacted. Afferent T2 through T7, efferent dorsal scapular nerve, integration center T2 through T7 spinal cord. Go ahead and lay back on your yeah, you can get flat. I'm gonna pull your shirt up just a little bit on your stomach. We're gonna do umbilicus deviation when stroked in any direction. Absence is normal, only if bilateral. So we go away from it, right? This way, and this way, and this way, this way. Yeah. Right, you're good. Thank you. And then plantar. So we're gonna take this and lift that foot up on, pick it up off the ground. Perfect. Good. I'm just gonna go. Cool. Good. And the other leg. Perfect. Good. Okay. Plantar flexion of toes upon stroking of sole of the foot. It's testing the tibial nerve, spinal cord S1 through S2, tibial nerve efferent. All right. Now into our pathological reflexes. We're going to go with, which ones? All right. We got Hoffman, which is when we, sorry, go ahead and sit up, let me see your hand. We're going to isolate this portion of your hand, let the rest of your hand fall. And then flick that. Try that over there. Same thing. Isolate it. Over here. Okay. And then we're going to try, flexion and abduction of the thumb with flexion of the fingers indicates an upper motor neuron lesion in the cervical cord or brain. Tromner. Okay, go ahead and go like this with both your hands for me. Upon tapping the palmar surface, we have no flexion of the fingers and thumbs, which is normal. The Tromners would be flexion of those fingers upon tapping the palmar surface. All right, we're going to do ankle clonus, which is the quick forcible dorsiflexion that causes continual contraction. No. Okay. Slightly, but not bad. We're going to now go through the Babinski's. Dorsiflexion of the big toe or fanning of the feet in an opposite direction when stroked or different moves. So we're going to go with the Oppenheim sign. application of pressure to the anterior tibia, stroking downward, anterior tibia, right, and stroking downward. Nothing. Anterior tibia and stroking downward. Nothing. And we've got Chaddock sign, down the lateral leg around the lateral malleolus, like that, and like this. Good. Sorry, it's not here. Gordon sign, which is squeezing of the cap. And Schaefer sign, which is squeezing of the Achilles.